Good evening once again, everyone. Thank you so much for joining us, and I apologize for starting a little late due to technical reasons. Right? My name is Anne Okiomi, and I'm your host for today. Briefly, we'll talk about lavender care before we go into the topic of today. Lavender Care is a postpartum care company, and when I say postpartum care, when people hear postpartum care, they ask, "Okay, are you saying you don't attend to pregnant women?" We love pregnant women, but we realize that pregnant women get some level of support and care while pregnant. I'm a mom myself. I'm a mom of three, and I've experienced pregnancy and postpartum firsthand over various period of time, and I can tell from my own experience and from the experience of moms I've also interacted with that you get the care you need while you're pregnant. And then when the baby is born, um, there's really no care. There's no, it just seems like once the baby is born, baby's fine. Oh, thank God. So we can now move on. But moms go through a lot. And then that is why we are here to ensure that when you think care after birth, you think lavender care. So our theme for the month is postpartum sexual health and wellness. And we thought that one of the key issues that moms have is their sexual health. You find that things are not really the same after you've had a baby, apart from the physical changes your body experiences. And of course, they would say that, oh, no need, don't worry. It doesn't matter how you look, you're a mom now. But the truth is, sometimes because we are human, for instance, maybe you used to be a size 8 before you had a baby, and then after the pregnancy, you're now like a size 16, and your tummy is everywhere and everything. You become less confident in yourself, right? And this just generally affects um, um, your sexual health and wellness. Apart from the physical um, aspect, you also have other aspects like the pelvic floor issues where you experience pain during sex. There are so many issues. As I'm not the expert here. We have the expert here, so but I just thought I'm just trying to give like an overview of why we decided to talk about this topic. And so when we were looking at someone who would speak about this, um, I had been following Dr. Faith for a while, and I see the work she does, and I see how she's she talks about this topic that many people shy away from. It's a reality for many people. Many people go through these challenges. Sexual health is part of our lives, right? But we shy away from it. We don't want to talk about it. But I see how she talks about it, how she supports women, to get better, to feel confident in themselves. And we thought that okay, she would be the perfect person to join us tonight. So briefly, I would talk about Dr. Faith before she comes on board. When she sent me her bio, because I said, let's have a bio to, just do a good proper introduction for you. So I'll just read briefly. So Dr. Faith Duncan Shaw today is an award-winning women and pelvic health physiotherapist and cancer exercise specialist with 14 plus years clinical experience. She helps women with sexual pain, fear, difficulty, and anxiety experience pain free, pleasurable sex using physiotherapy protocols with proven results within 15 days of implementation. She designed a pelvic physiotherapy digital tool, Thrust Perfect, accessible by women anywhere in the world within the comfort of their home to resolve painful penetrative sexual experiences. She pioneered the Women and Pelvic Health Physiotherapy Clinic in Lagos State Health Service Commission, which caters for pelvic floor problems in male and female, pregnant and postpartum, and menopausal challenged women. She trained many physiotherapists to serve the women population and helped establish over 11 more women's health physiotherapy clinics within the commission. This helped increase the revenue generation by over 300% in all physiotherapy departments with women's health services. She has an array of awards, including Top 100 Career Women in Africa 2024, Best Physiotherapist 2023, Lagos State Health Service Commission Physiotherapist. Best Technical Support of the Year 2022, Lagos State Health Service Commission Physiotherapist. Winner International Essay Competition, She Decides, um, 2018 by the FC2 Female Condom. She has an amazing experience working with women, and she gained her background is in education, is in physiotherapy from the University of Ibadan, and several other international certifications and memberships and licenses to practice both in Nigeria and the United Kingdom. Ladies and gentlemen, I want us to put our hands together wherever we are, clap our hands, put our hands together as we welcome Dr. Faith Duncan Shotsade. Thank you so much.
Thank you so much. It's always so funny when I hear my bio being read.
I know, like me.
That's me. You know, and honestly, when you are doing the work, you actually don't realize how much you are putting in and how much value you are getting at the end of the day. Until you start to put them together and you're like, wow, that's a whole lot. That's a whole lot.
And I didn't even finish it, so it's like a book. Welcome, Dr. Faith. You have the floor.
Yeah. So because of our time, with logistics and everything, and we know this time is a time where ideally we expect that couples should start to wind down for the day so they can spend some time together. As we progress, I just want everybody on this call to know that this is a no holds barred call session where we all should be open to talk about whatever it is. Now, we're talking about something really sensitive already, and that's why we had to move it away from Instagram so that it can be a cozy space where we can share as much as we have on our minds to share. So I'll just share my screen so that we can start from there. So today we are talking about the pelvic floor and pleasure, what your doctor won't tell you about painful sex after childbirth. And I'm so really excited about this topic because like Mrs. Ogunyomi had mentioned, in fact, I don't think that people get to even have this conversation in the hospital after they've had their baby, or even when they go for their 6 weeks postpartum check, and this is just a good avenue where I talk about this to my pregnant mothers, those who attend the PregoFit sessions, but having to speak about it, particularly sex after childbirth. This is the first time I'm having to speak with a group outside my pregnant moms group, right? And I'm happy that this is going, touching other people beyond my own immediate circle. Okay, that being said, very press next. All right, so she has said a lot about me, and okay. So, but basically, to wrap up everything that I do, Faith Duncan Shotsade, what she does is to help women to be at peace with their bodies, no pain in any form, no leaks, no pressure, all through womanhood. So whatever phase you're in, through body knowledge and physiotherapy protocols. And that is just like an umbrella. It encompasses a whole lot. So if you think at some point you feel certain pain or discomfort, I usually tell people that no matter how little that pain is, it's a signal that we need to do something. Don't ignore it. Pain is an alarm system, so we shouldn't ignore it. So while we are here, I've already said at the beginning that this is a place where we should feel as comfortable as possible. So I want us to write in the chat section where we are joining from. Please write in the chat section where you're joining from. And as you are also writing, also put in the chat what 3 challenges you are experiencing with sex so far. So as a woman, as a man, as the partner to the man, to the woman, the supportive partner, what 3 challenges, out of all of your challenges, which one can you say are the 3 specifics that concerns you so much that you wish you could just tick off your list, and if you tick it off your list, your life would at least be a lot better. Please, I would encourage us to write in the chat. And then you're going to take 1 minute. I'm going to give you just 1 minute. I want you to intentionally think about how you want to experience sex. So you've had a baby now. You just had a baby, or you've had a baby 6 months now, or 1 year, 2 years, and it's not what you expect. You know, your sexual experience is not the same anymore. How do you want to experience sex? I'm going to give us 1 minute to think about it, and then you also write that in the chat. We are going to come back to it. Please write in the chat. I'm checking my timer. 1 minute. So once it's 9:07, we move on. Think about it. So what's my desired sexual experience? I've had a baby. What do I really want? You know, sometimes we just, once baby comes in, we just move along. We just like, okay, what's the next thing to do? In fact, we're not even having a breather. We are not having that time and space where we are like, this is my own time, or this is the time for me and my husband, you know, to ask each other what is really important to us, what actually makes us feel better or feel happy at this point. You know, time is just ticking and ticking and ticking and ticking. So I want you to take 1 minute to imagine if this baby was not here, or if I had not gone through what I went through, how would I want to experience sex? Okay, so 1 minute is up. Like I said, we're still going to come back to it. Feel free. This is a place where we want to, as much as possible, get answers to our bordering questions. Okay, so for us to understand why sex is actually painful, it's very important that we know what the normal is, what the woman's body is like, why it is that after sex, things just seem to, after the baby, things just seem to go off the hook. What's happening? So, excuse me, we're going to look at the overview of the female body, how they work as a thing. Okay. How can I minimize this stuff? All right, so can we see the titles of this slide? Or am I the only one who is being blocked?
Yes.
All right, okay. Okay. So if we look at this image on your screen, there are 4 major parts to this image on your screen, and they all are working together to keep your body in shape. And it also has its own impact on what your sexual health is going to look like. During pregnancy, this image where my cursor is, this is your breathing muscle. This is what we call the diaphragmatic muscle. And it's the one just at the top here. Whether you're pregnant or you're not pregnant, this one, this two, this is the abdominal muscle here. And this one below is the pelvic floor muscle. And the one which has the spinal bones is the back muscles are there. So these 4 group of muscles, they are beyond one. We're just using these icons to represent them. They all work together. If you look at the arrows, they have to work together to keep the pressure inside this trunk as a whole unit. Otherwise, you fall apart, or you start to have pain anywhere in your body. And that pain could be in the pelvis, it could be in the abdomen, it could be around your rib cage, in your chest, it could be at your back. And when you are pregnant, all of these 4 group of muscles are going to be strained and tried. Okay, so now imagine this is without a pregnancy, without a baby inside. Once there's an extra load here, all of these are going to be stretched. So imagine what's going to be happening if this breathing muscle, I'm going to try as much as possible to use layman's English so that we can understand. This breathing muscle, if it's pulled way beyond this position now and it's pulling and pushing into this bone at the back, you're most likely going to be having back pain. And this can happen with poor breathing techniques. You're going to be having pain. It could be it could be the pain in your upper back. It could be pain in your neck. It could be pain in your shoulder. It could be pain anywhere in your back or even in your chest between your breasts. Same thing with this abdominal muscle in front. If anything causes an extra strain and there's no good support, this muscle is also going to be overstretched. It's going to be pulling on other things. Now, something very interesting is this. If you look at the bone down here, you'll see that this abdominal muscle actually connects to this bone in front. And so, let me just, okay. So that's, looking at this model, there's a bone coming, like covering your abdomen here, and then it's coming and is inserting on this bone. So if there's anything wrong with that muscle, that means every other thing that is connected to that muscle is going to be affected, just as we can see from this model. And we all have these. So if you touch your waist or you touch your hip, you will be able to hold on your waist. This is the bone you're holding on your waist. And if you feel any bone in front, this is what you're feeling. So if anything happens to that abdominal muscle, there's going to be pain and discomfort. Same thing with the back, and then of course our pelvic floor muscle, which is at the base. And just see, they're all connected to the bones. The breast is just above, you know, the skin is also indirectly attached to this four group of muscles. Now, when we remove the muscles off of this pelvis, your waist bone, so what you see, all this red meat that you see is the pelvic floor muscles, right? If we now take off this pelvic floor muscles, we have what we call ligaments. And look at how many they are. These ligaments are like rubber bands that actually hold the joint. So something that we can actually relate with will be when we have an ankle sprain, or usually when we say we have an ankle sprain. When you sprain something, you're spraining the ligaments, right? So the same thing that happens when you actually sprain your ankle, either due to poor movement, or walking on something, or you hit your foot on something that hurts your ligaments and the ligament tore. Anything that can happen to the ligaments in your ankle also can happen to any of these ligaments during pregnancy and during childbirth. I hope we are able to appreciate what we are seeing. Look at all of this white tissue around this is your thigh bone going into your hip. This is what you have around your tailbone at the center, and then in between your buttocks, deep inside. And all of these white tissues that are like rubber bands, when they are overstretched, which would happen during pregnancy, they can be injured easily. More so when you have a long labor period, and a lot of manipulations had to be done. Maybe they had to cut you, maybe your baby had to tear you, or some things just happened. And these ligaments could also have been affected even during pregnancy by the weight of the baby, by your poor posture, by the way you carry things during pregnancy. Okay, now okay, we'll move forward. Now, looking at it at a closer range, what happens when there is now a baby inside the stomach? If you look at this image on top, there is no baby yet. So you can see the womb, which is called the uterus, and your ovaries, the fallopian tube, they're all attached to the womb. And there are ropes as well, beyond the ones I showed you initially. There are other ropes, just permit me to call them ropes so that we can understand, like rubber bands that try to hold the womb, the fallopian tube, the ovary, the bladder together. But the one that, the doctor will maybe mention to you often, or what you will find on the internet often, will be the round ligaments. Because most pregnant women will complain of, oh, I have pain around my groin, or just around the belly, and they will tell you, oh, it's the round ligament that is actually being stretched. So you can see how much this round ligament is being stretched with pregnancy on this image, right? As against when there was no baby. Now, what I was trying to tell you initially is this. In this bowl, you have 3 organs in them. You have 3 organs in them. And they are held together by those rubber ropes that I mentioned as well. So I'll just show you. There are 3, right? So we have the bladder. This is where your urine stays right in front here, underneath the womb. Then you have the womb on top. And then you have the rectum where your poo-poo passes through. Now, these 3 organs, for them to be in their right position, there are those rubber bands that also hold them together in this queue. There are rubber bands that hold them together in this queue. There are rubber bands that hold them side to side so that they don't move. Now, when there is a growth of the baby and this is being stretched and is, filling up, it's also going to pull on any other thing that is attached to it. So just in your mind, picture how much of pulling that is happening. If just the round ligaments itself could be this stretched, right? And like I explained earlier, just imagine what actually happens to you when you have an ankle sprain. So any of those things can happen to any of the ligaments that hold these organs together during pregnancy. So this is just a bit of a pictorial view of what I explained with the model. This is the floor of the female pelvis. This is your right hip bone and your left hip bone. And you can see the attachment of those muscles into the bones. There are 17 paired muscles within your pelvis. Do you know? So the same way you are concerned about the muscles in your arm or the muscles in your buttock, you have muscles down there that you need to actually also cater for. And if you look at them very well, you can see, okay, so the clitoris is this lilac up here. It is surrounded by the pelvic floor muscles as well. You can see the yellow indicates where the pee comes out from, and the pink actually indicates the vagina. And if you go way below, the brown indicates the anus, where poo comes out from. So if anything, just imagine now your muscles are stretching. They can stretch, they can contract. So if they are stretching, just imagine what is being stretched. If they are contracting and they stay in that contracted position, you can also imagine what's going to be happening. So there's going to be compression of whatever is within those muscles or within that bone, right? And if you look on this other picture where my cursor is, this also gives you a pictorial image of what's of the 3 organs I mentioned earlier. This yellow indicates the bladder. This is the womb. And this passage below the womb is the vagina. And this is the rectum where the poop comes out from. This lilac down here is the clitoris, okay? I'm just trying to lay the foundation so we can have a better understanding. So why is sex after childbirth painful? If you are if you are following me and you are using your mind's eye, you should already know why it would be painful. Okay, so truth be told, a vaginal delivery is equal to a major sports injury. But rarely are the muscles given the time or attention needed for a full recovery. And you bear with me that most times, just like Mrs. Ogunyomi had mentioned, once you have your baby, the next focus is on the baby. Nobody cares about the woman, and then they're expecting you to be up and doing. They expect you to be, be available for the baby, be available to your husband, be available to every other organization that you belong to, because you just have it at the back of your mind that the baby that we thought was actually making you unable to do certain things is out now. So What else? Why should you be complaining, right? But we forget that the person who carried the baby, or the container that carried the baby, some processes happened and occurred during that period. And work has to be done to actually care for this person, this individual. So as the baby is coming out, from where my cursor is, it's like you're putting a lot of pressure, a lot of tension on the passage where the baby is coming out through, the pelvic floor muscles, the ligaments that are around there, the organs that are surrounding the womb, the organs that are within the pelvis, every other thing that is connected to the womb, connected to the passage, the clitoris, where the pee comes out from, every other thing around there has been put to a times 400% extra stress during childbirth. So do we actually expect a bounce back quickly? And unfortunately, I've heard women who actually resume sex in 6 weeks, resume sex in 2 weeks, in 1 week. So it's good that we're having this conversation, right? We need to give the right time and attention the way we would give to someone who sprained her knee or sprained her ankle to a woman who has just given birth. So just imagine if your wife or your husband actually came home and said, oh, I have a swollen foot, and I think I actually hit my ankle or my foot on something and it's painful. I can't walk with it, it's swollen. Do you also know that, in the few days after birth, the pelvic floor, the vulvar area can actually also be swollen from the trauma of birth that actually happened. So we need to give, that same care and attention to the woman. For those that are just joining us, I asked us to write in the chat the 3 major challenges that you're facing with sex at the moment that you want to be solved, and then what you would like your sexual experience to be. We'll come back to that towards the end of the webinar. So why pain after birth? It's not far-fetched. Most likely there are sprained ligaments. There are overstretched muscle fibers. Our muscles are not rigid. An example is this picture that we have on the screen here. You can see her skin being pulled forward. You can see this sagging line where her hand is that is trying to support her back. See how the belly is dropping down. And I'm sure people have told you, or you have heard, or you may know that they say that when the stomach is looking like it wants to drop forward, it means that the woman is ready to give birth. That is a myth. So much of a myth that needs to be corrected. For a shorter labor, we want the abdomen to be upright. We don't want it to be sagging. We don't want it to be pointing downwards. This does not even determine if the baby has descended well or not. Okay, so you can see that the skin is being stretched. Now, looking at this from the outside, seeing just the skin being stretched tells me that there is more strain happening on the inside of this pregnant body. So it could be sprained ligaments, it could be torn ligaments. It may be, the ligaments are in fibers. If you actually observed the ligamental picture I showed you earlier, you have them in strings. When we eat the normal cow meat, you can actually cut them into strings, divide them into strings, the same way our own muscles are and our ligaments are. You can actually, divide them into strings. Now, certain injuries may just be 1 string or 2 strings, so it's not a major one. But for some, it may be 70% of the fibers in that muscle belly that actually got injured or got torn. So, if anything like that happens, that means that particular muscle fiber will not be able to do the work it's supposed to do. So, I don't know if you can see this very well. Yeah, so you can see the lines. These are fibers. Imagine if this muscle, the muscle surrounding this rectum, tears from where my finger is at the base here up to the middle. There's going to be a lot of, there's going to be a problem when it comes to pooing. A lot of problem when it comes to pooing. And now imagine that in any other part of the pelvis or the woman's body. Torn muscle fibers, imbalanced hormones. once your baby is out, the hormones that your body starts to produce is different from what you have for sex. Why? Because at that point, your body understands that now you need to start to breastfeed your baby. We're not trying to get you pregnant. So, I mean, we don't have sexual hormones at that point. And we'll delve deeper into this in our upcoming workshop. Okay, additions from scar tissues. Majority of women have episiotomy done on them, or they have their babies tearing them. What is episiotomy? If you don't know, episiotomy is when your doctor or your midwife, this is the perineum, when your midwife cuts you either laterally, either midline like this, or they cut you diagonally in either direction to create more room for the baby to come out, right? Is this really necessary? If it's an emergency, well, yes. If it's not, if you had actually participated in pregnancy safe exercises designed by pelvic floor physiotherapists, you most likely would not have a reason to have an episiotomy cut. Now, when this have an episiotomy, or a perineal tear, because we would have worked on your total body muscle so that your pelvic floor muscle, your perineum, is actually flexible enough to expand to 4 times the original size, and then allow the baby's head and body come out with ease, which that should be the natural process. Okay. Now, when you have a cut or you have an episiotomy done, and then they suture, as healing is taking place, wherever there's an injury and healing has to take place, as healing is taking place, the way the body works is that, even for us as human beings, when we have a cloth or our dresses that has a cut and we want to mend it, we tend to place the fabric over each other so that it becomes more difficult for it to tear again, right? So when healing is taking place, the body on its own as well tries to do that, causing a thick, soft tissue of healing. Now, if we don't work on those tissue, it gets thicker, it gets stuck. When it gets stuck, imagine if the original length was the way, just the way my hands are on the screen. The original length is this. So when there's a cut and then there's a suturing, we are overlayering, then we suture. And when healing is taking place, we're doing that. Now imagine how many inches this length has been shortened. And the fact that my right hand has moved from the starting position shorter into this, now into my left hand. Now what's going to happen is, whatever my right hand is attached to on my body is also going to be pulled alongside that repair. As that repair is being done, it's going to be pulled. That's going to cause a strain on all the other things that are attached. That's why I said I needed to lay the foundation with those images I showed you earlier on. So you can start to imagine what's connected to your right pelvic floor muscle. So let's say you had a cut, wherever that can be. That's if you had a vaginal birth. Even when you had a cesarean birth and you were cut, bikini line, whether it was a long line on your abdomen, wherever there's a cut in your body and healing is taking place, that overlapping happens. So it's going to be pulling. If it's on this side, it's pulling this bone, it's pulling this your hip bone. It's not an obvious pull that for some people it's obvious. But for some people, it may not be obvious. What we start to see are the signs of this pull. So no matter how little this pull is, it's also going to pull the backbone that is around the buttock. Now imagine that there's a pull on the hip bone. It's pulling on the bone around your buttock. It's pulling on your spine, above it. You can just imagine what could be happening. It's also pulling on the muscle that connects to your shoulder, connects to your neck. Some people may be having headaches, constant headaches, just because the adhesions from their scar tissue, from their cesarean section site, or from their repair of the neck of the cervix, or from the repair of the perineal muscle, that's the pelvic floor muscle. You know, it could just be because there's that pull, there's that pull, there's that pull. No matter how little, the pull is going to have a ripple effect all over the body. And that can also pull on this area where we are supposed to have intimacy, sexual, good sexual experience. This yellow dot is the clitoris, right? So if there's a pull here, or there's a pull from the left side, maybe it's pulled apart or it's pulled inward, there's a pull, there's a tightening. So it's going to affect the proper functioning of the sex organ, the clitoris. It's going to affect how you urinate. It's going to affect how you poop. It's going to affect how there's going to be penetration happening, you know, at the center. Okay. Then we have altered night sleep. These are reasons, I mean, and I'm sure maybe you've never thought about it the way I'm talking about it today. And people would say, oh yeah, go and get lube. Go and get lube. Okay. Altered night sleep, which is very common with someone who is breastfeeding. Once your sleep is, especially the night sleep, there's a problem. There's a problem with your overall health, because you start to produce the stress hormone. And once you have the stress hormone, you're not going to be interested in anything that has to do with pleasure or intimacy. You know, and a whole lot goes into altered night sleep, a whole lot beyond just what I'm mentioning right now. Another reason is traumatic birth experience. This is something usually overlooked, you know, overlooked by the spouse, overlooked by the healthcare provider who is giving you your 6 weeks clearance, despite the fact that after you had your baby, you're just wondering what has happened to my body right now. What am I going to do moving forward? And then you're given the full responsibility of having to take care of a new human being, right? A very fragile being, and the responsibility sort of solely stands on your table, you know, and nobody's addressing how did you feel with your delivery process. How did you feel as a human being? Did you feel less of yourself, or did you feel like this is an experience you want to have again or anytime very soon, right? These are things and factors that can actually contribute to pain with sex after you've had your baby. What can you do about this? So very importantly, not one size fits all persons, because for certain individuals, their birthing experience may not be as bad as certain other people's birthing experience. Some people may not have had tears. Some people may not have had, may have had their choice of delivery option. So some people go in for delivery with the plan of having a vaginal birth. And then, I mean, that's what they really wanted to have. And at the point where they had to make a critical decision, they are shoved with a cesarean birth. And if that is not even addressed, it can actually sit in as trauma for the woman, making it difficult for her to even want to have to do anything that is connected with going into that same scenario, which is you're going to have sex, and then you're going to get pregnant, and you're going to go to the labor room to have your baby. So basically, I've just categorized everything. What you really need to do under these 4 factors or 4 pillars. It's very important that you get a pelvic floor assessment done with a pelvic health physiotherapist. Now, here's a caveat. If you don't do, or let me start with if you do. If you do, it is actually going to help you to resume sex faster. That's number 1. Number 2, is going to prevent you, or it's going to help you pick things about your body that needs to be addressed while your body is recovering. You know, looking at how your lifestyle is, looking at your social life, your work life, your physical well-being, and seeing what how pregnancy and childbirth has actually altered all these things, and then what you need to do so that you're not having other issues like what we call pelvic organ prolapse. If you've not heard of pelvic organ prolapse before, pelvic organ prolapse means that either of the 3 organs I mentioned earlier that are inside this bowl, they can start to fall out. Either of these 3 organs, they can start to fall out through the vaginal canal in different degrees, right? And if you don't even get to know those on time, it will be an issue that can actually also affect intimacy. Because, tell me how, before you got pregnant or before you had your baby, you were a sweet 16 down here, right? And then you had the baby, and all of a sudden, this place is looking like a grandma, number one, or you're now having to see your womb popping or is blocking the entrance of the vagina. Once you just put a mirror, you can see that the womb is blocking the entrance of the vagina. That on its own alone may not even allow you want to have sex. That on its own may also make your partner think like, what's happening here? Excuse me, for the very sensitive and caring partners anyways, okay? So it's important to get a pelvic floor assessment done with your pelvic health physiotherapist. Get a birth debrief session. Before I jump to a birth debrief session. Now, when you get a pelvic floor assessment done, your pelvic health physiotherapist will be able to design specific rehabilitation plans targeted for you to help you actually even, accept certain things, move forward and progress with certain things. Like I said, not one blanket fits all persons. In as much as we may have some general things that we can talk about, but then for some, you may even still do those general things, and you still find out that you're not in tune when it comes to intimacy. And we'll be looking at a lot of this in something we're going to talk about later. So get a birth debrief session. It's very important that you get a debriefing session of your birth. That actually would help you and your partner to process every single thing that happened while you were pregnant, while you went to the labor room, when you had your baby, how you felt after you had your baby, what you both are looking at as a family now that your baby is here. This is something very important that most couples actually do not do, especially in this side of the world, Nigeria, Africa, as a whole. This goes a long way to help your mental health, helps you to plan, helps you to heal better, and helps your family to bond as one. Get a body-ready sex clearance from your pelvic floor physiotherapist. Now, as you're getting your 6 weeks postpartum check with your doctor, if they don't send you to see a pelvic floor physiotherapist, please request for one. And if they don't even give you a request, a referral letter, you can see a pelvic floor physiotherapist as a first contact. You don't need a doctor's referral letter to see a pelvic floor physiotherapist at all. We don't need a doctor's, we are first contact. Physiotherapists are first contact. Pelvic health physiotherapy is a specialization in physiotherapy, and you can actually just, find a pelvic floor physiotherapist around you and request that you want to have an assessment done. You want to get a sex clearance. Husbands should even support their wives to do this because it's really for the good of the both of you. You want to get a sex clearance at 6 weeks. At 6 weeks, we want to look at, are you ready? Are you not ready? After 6 weeks, at 3 months, you want to come back to still get, to get that clearance. For you to get that clearance, we're going to do some review. We're going to do some assessments again. Okay, are you ready? Is your body ready for sex at 6 months? After 6 months, it depends. So if in 6 months, we are like, okay, fine, you're good. Sure, you can go ahead. At 1 year, hopefully, most likely, we want to believe that you should have resumed sex. But you may still be having some challenges. Anyways, if you had actually come from 6 weeks, 3 weeks, you may not even have to wait as longer than 6 months. From what I've explained, in getting a pelvic floor assessment, because we would have been able to pick the things that you need to work on your body. Now, don't forget as well that pain with sex is not localized to just this, the vulva. It's not localized to the region between the two legs of the woman. If there is pain anywhere in other parts of the body, anyone who has pain is not looking forward to some cloud-9 experience, in all honesty. Anyone who is having poor sleep is not looking forward to a cloud-9 experience, you know. So the importance of the pelvic floor assessment, or the pelvic health overall assessment, the body ready sex clearance, is looking at everything as a whole package. What do we need to work on to ensure that you hit your intimacy goals as early as possible? Then, of course, communicate your exact feelings with your partner. It's very, 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 very important. Women are found to actually harbor or keep in their minds a lot of things that are going on their mind, especially when it comes to intimacy. Women are the last to talk about, oh, guy, this is how I want it, or this is how I feel, or this is what I think would be better for me. We actually shy away from having such conversations, especially when it comes with the child in the picture. You don't want to feel guilty that you are using the child as an excuse. You are also feeling like you have an obligation to your partner to, you know, provide sexual satisfaction to him. But if you guys don't sit down to have this conversation, both parties are going to think, the wife is going to think, oh, my husband is insensitive. The husband is also going to think, oh, she's insensitive, especially if during pregnancy, you both had abstained from intimacy. You had abstained from sex, you know, and then your husband was actually waiting that, okay, so when the baby is out, I'm going to be able to do this. Unfortunately, you're forgetting that the vessel that carried the baby also needs to be cared for, not just, I mean, to be cared for beyond, oh, you know, I love you, you know, I care for you, you know, I support you. There are some practical things that need to be done. I mean, look at this woman in this picture. See the husband has even gone to, has gone to sleep, but the woman is like, oh, I'm dead. Like, why does it have to happen? Or is like you're breastfeeding and then your husband is like, I need this. You know the response in your head before you try to re-engineer the response to put it in a sweeter, if you can, in a sweeter way to communicate, or a way to just say, okay, let's just endure this. But you shouldn't at any point be enduring sex. No, you shouldn't, because every time you have a painful or an uncomfortable experience of intimacy, of sex, every time you just do it for obligation and you're not involved, practically involved, your brain is registering each time, is registering those processes and is sending a feedback to your body that this is not an activity that you want. So you are not going to, if you don't address it, you're not going to get any better with it, okay? Just a moment. Not yet, please. And yes, please, my meeting. Thank you. Right. Okay, so let's look at what we have in our charts. What sexual desires do we have in the charts? Let's see. Oh, wow, we have people from Abuja, Lagos, Kano, Chicago. Wow, Jared, we are glad to have you from Chicago. Our Kano lady, we are glad to have you. Sola, he says, we don't talk about the issues. Lack of sleep, thank you. Lack of sleep causes enough. Very, very true. Okay, so nobody here has said anything about what they want. They their dream sexual desires. Nobody has said anything. All right. They are shy. Okay. A closed mouth. Let me not say. Anyways, it's okay. It's okay. It's okay. It's okay. So if you are, if you feel you're shy, okay. So well, if you're shy, we can actually have a one-on-one. You can have a one-on-one. Unfortunately, one-on-one comes at, I mean, you know, comes, well, I wouldn't say it's expensive because when it comes to health, nothing is too expensive. Nothing is too expensive. You can't even imagine what you're going to be having to deal with when you don't address the issues you need to address. Are there scenarios from your experience you can speak about? No, I'm not going to speak about the scenarios from my experience. I have a lot of, if you go to my page, my Instagram page, I have a lot of stories I've shared. I want to work with the people on this call, and that is why we decided to take the conversation off of Instagram, right? Okay. Okay, maybe I should give you one experience, top of my head. Right. Okay, so there was this woman who had just had a baby. She had come to the hospital. She had seen her doctor for a clearance, and I told her all was fine. The reason why she came to see me was because I went to the mothers section where they were having immunization. And then I started to talk about the different things they might start to see in their bodies as fresh moms, either the first time or a second time or a third time mom, right? And then when I mentioned if they have any concerns, they should come to my office and let's have a chat, let's talk. So she came, so I mentioned about pain with sex. In fact, that was like 6 weeks. Yeah, that was like about 6 weeks after she had had her baby. So that means she had started having sex at 6 weeks, right? But it was painful. It was really painful for her, but she was enjoying because she felt that was the norm. That was, I mean, like nobody's talking about when should you start sex after you've had your child, right? So, but she was experiencing pain. Then she came, I checked her, we did some assessments, and she had a growth. She had a growth just within the vaginal wall at the entrance of the vaginal canal. So this is the vaginal canal here. So there was a growth, you know, and that growth was painful. It was close to the perineum where they do the cuts or where the baby tears you. It was painful. And touching it was also painful. And then she was like, I mean, I had to say like, okay, what have you done about it? What are you doing about it? She said she believes that it's true. Someone said a better sex drive. This is an umbrella response. You still have to give it specific. So said that she's just been enduring the pain because, I mean, during pregnancy, she wasn't having sex with her husband because she wasn't comfortable with it. And she felt, I mean, her husband had tried and she had given birth now. So she just needs to go ahead and start to, I mean, by obligation, you know, endure the pain and then allow her husband to. And then I told her she didn't have to. And I asked if she had that conversation with her husband. She said no, that how many minutes now? Maybe he will do and he will come out. He will be fine. But what she didn't realize was she was causing more damage down. I mean, I will be talking more about what damage occurs within the pelvic area, the vaginal walls in the next thing we're going to be talking about. Dr. Anne is going to throw more light on that. We're delving deeper into all of these matters, okay? So we started some pelvic physiotherapy protocols on her, and it wasn't even up to 15 days, you know. She came back, I told her what to do. The first week she did it. The second week she did it. By the second week, so women making love to their husband after pregnancy as a privilege or consolation prize to not hurt their ego. Well, it happens that most women do that. That is why most women actually do, because in all honesty, I'm not sure I mean, they should have resumed sex, I mean, after pregnancy. Yeah, immediately after pregnancy, or even 6 weeks after pregnancy. Anyway, so she came back and then she was like, wow, that husband was so, sorry, excuse me. Yeah, excuse me. Thank you. Right. Okay, so she came back and said her husband was so excited. And her husband was like, the place felt better. 1. 2, the pain she had been enduring was no longer there. And she was like, she never got this information from her doctors. Then she said the growth was a concern for her. I said, did you mention it? She said they saw it when she went for the 6 weeks appointment, and they didn't say anything about it, but she doesn't like it because that's not how her vagina was before she gave birth. So that was a concern for her, and she wasn't addressing it until I pointed it out. Do you understand? And I had to like make a referral connection with her gynecologist that, that needs to be addressed. And, it got sorted. So it's very important that you communicate. It's very important that you see a pelvic health physiotherapist. How many months or years should the men wait after childbirth before you sex their wife? to avoid all the stories that touch. So it's not a matter of how many months or how many years. Like I said, when I was talking about what should you do or what can you do when you've had your baby or you're experiencing painful sex. Preventive measures. Okay, no, let me just add this first. It's beyond the timing of the months or the years. Like I said, if you started at 6 weeks, there's a higher chance that you're going to be closer to your intimacy goals than, when I say if you start, what I mean is if you have seen a pelvic health physiotherapist for sexual clearance at 6 weeks, at that point we are able to pick whatever might be the blocking issues, whatever might be preventing you from actually achieving intimacy, as the way you want it. So if Thrio, husband, wife, pelvic health physiotherapists are able to work out something, agree on something that works, then it may even take you maybe 6 months to start. It may take you 3 months, right? So it's not necessarily the duration. It's when you don't address those issues. If there was a cut in the muscles, a cut in the ligaments, if you have scars, that were sutured, that have not been, worked upon, if those things are in the way, if there's, altered sleep in the way, then we are delaying how soon you actually want to start pleasurable intimacy that both partners are actually interested in. Are we talking about preventive measures? Yes. So one of the preventive measures is that when the woman is pregnant, thank you for asking if we're talking about preventive measures. During pregnancy, please don't just do the regular antenatal that hospitals offer. If your facility does not have a pelvic health physiotherapist on your antenatal team, the best thing for you to do is to personally sign up for one, in all honesty, because there's so much that, and if you bear me witness, everything I've said today, if I'm lying, please tell me if you have heard this somewhere else before, or today is the first time that you are hearing this, or if you heard it from your O&G doctor or your midwife, okay? The things that they teach you or the solutions that they give to you, they are on the surface. It does not actually put your whole body system, especially when it comes to your muscles, your joints, your ligaments, it does not put them into consideration. For them, what matters most is baby is alive, baby comes out, mother comes out, even if they have to butcher the mother. I've heard women after birth who would say that they felt like they were a cow on the delivery table, Their opinions didn't matter. It didn't count, you know. It's just, oh, we need to do this to save the baby. Okay, whether even if you have to just cut her anyhow for the baby to come out, pull her leg like a chicken's leg from left to right, just for the baby to come out, just let the baby come out. And then they load you with, they load the woman with somebody's laughing. They load the woman with loads of painkillers. Okay. So what is very important is that when you do pelvic floor physiotherapy in pregnancy, you are at a higher chance of having low risk of postpartum issues or of sexual pain issues. The mothers who join my PregoFit program, who start from first trimester through the third trimester, they don't have tears, they don't have cause, they do vaginal delivery. And, you know, even their husbands attest and say they have never experienced birth that easy before. And they didn't even know that it was possible, that delivery could be that sweet and easy. And, you know, for me personally, after my second birth, when I had my baby, that's my second child, I actually, the joy that was exhuming from me was like, if delivery can be this sweet, we can do another one now. In as much as at the back of my head, I'm like, I'm not doing another one because of delivery, I mean, labor contractions and all of that. But the process was the sweetest for me because, of course, I put into practice all these things that I'm talking about. Okay, so let's see. Are there sex styles that help make the pain points lesser or convert into pleasure points? Of course. And we are going to be talking about all of this in our workshop. We have a workshop coming up. We are delving deeper into all of this, in all honesty. So we really want you, if you need more solutions, more information about, and the workshop is going to be practical, very, very practical, very, 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 very practical. Someone said no lies, no epidural. Oh, epidural. Oh, well, do you really want to do epidural for the sake of your baby and yourself? Well, there are people who have who do epidural anyways, but truth is your body is designed and made to have a delivery, a vaginal delivery, or whether it's a cesarean section, so whichever one you choose, your body is empowered to actually do all of these things. What matters is how are you caring for this body? How are you caring for this body? Okay, so preventive measure, what I was saying is have a pelvic, am I the one raising up my hand? Have a pelvic floor physiotherapy sessions during your antenatal. It will prevent you from having other issues while delivery goes on, and then after you've had your baby, and of course, every other thing is going to be sweet moving forward. At what stage are these conversations had with women or their husbands? What conversations in particular? What conversations in particular? Is it the sex conversation? We talk about sex in our pregnancy class because we also expect that you should have sex in pregnancy. How to go about that is part of what we teach in our pregnancy classes. Okay, so we talk about that in pregnancy. Then when you have your baby, we also talk about that when you come in for your, when you reach out to us for your 6-week clearance, and it may even be just after birth, yeah? The conversation can be had at any point in time, Please, pre-pregnancy sex, during pregnancy and post, yes, we have these conversations anytime. Pre-pregnancy, so like I champion on the virtual space intimacy, sexual health with physiotherapy interventions. not as much as I do every other thing that relates with pelvic health in the background, but because I know this aspect of the male and female health, particularly the female health, is rarely talked about. People don't even want to boldly talk about it. Even health practitioners shy away from it. People would not be on the live, but will come and watch the replay of the live after, and then I'll and I can totally understand because of the culture around this aspect of health. And even healthcare practitioners don't really want to be involved per se. So yes, I have products for sex before pregnancy. That's I have for couples, which is becoming sex mates. I have for those who are married and they're just having issues, they get to get pregnant and they're just having some missing link somewhere. We have Thrust Perfects, we have becoming sex mates, we have Thrust Perfects, depending on what your own specific need might be. Now, during pregnancy, we talk about this in the Pregofits. Then for post, that is why we are here for after birth. So that's why the workshop is actually coming up rather. So husbands and wives can talk about sex, how they feel. Communicate with your partner, very, very important. Are there solutions that are not invasive? It depends on, so invasive, it's your body. So the way I treat my patients, I teach you what to do and you do it on yourself by yourself. That makes you a pro in charge of your own body. I run a digital service. So I am able to serve people from anywhere in the world. What's that? So I teach you what you need to do for yourself and you do it by yourself. You are empowered to do what you need to do. I believe that my clients, in fact, not just my clients, I believe that when we approach healthcare that way, people can be more responsible for their health, as against when you think, okay, it's only when I go to see my doctor that I am served or I feel better or that's when I get my solution. But when you know that you have the power to do this for yourself, then you do better. You take your treatment plan very seriously. And for most of my clients, we always get results within the first 15 days of working with me. So let's go on to what we have for you. So if you look at this image, I'm like, don't be like this woman here. Don't be like this woman here. When your husband is not around, you will just be thinking about the story of your life, knowing that I'm still having to nurse this baby. And then when my husband comes back, he's probably going to be requesting for sex. How am I going to respond to him? And husband, if you put a camera in your house and you're watching it later and then you see that maybe this is how your wife is always, she's having deep sighs and or she's sitting in certain corners, she's just thinking, she's lost, she needs help. Okay, don't be like her. Register for our 10-day pelvic health and pleasure after baby workshop. It's 30,000 naira. Mrs. Ogunyomi actually twisted my arm so much for us to actually get to this point. And we are, as much as possible, trying to do, so those who register early would also get a bonus pelvic floor assessment, one-on-one assessment with me, so that at least you can have a full feel of the workshop. It's a 10 days workshop. Every day comes with its own task. There are actions that you have to go and do at home with your husband, on yourself, so that by the end of the workshop, you are way better than when you started the workshop. It's not we just learned and we have heard what she's saying, but what are we going to do or how are we going to do it? So it's a task-oriented workshop, and they are getting a whole lot of value for chicken change. So if you would like to explore other pelvic health services, you can shop for them on the Lavender Care website. I have a partnership with Lavender Care, so you can go through their website. We have, I think it's just one on their website for now, but After this webinar, subsequently, they're going to be uploading some other pelvic health services that the Woman Health Physio provides. And don't forget, our services are virtual, so you don't necessarily have to travel down or come in person to a clinic. There are ways around this. You get your solution wherever you are, right? And if you want to learn more, you can also follow me on Instagram at the Woman Health Physio. I'll leave Dr. Ogun, sorry, Ms. Ogunyemi to talk more on the workshop. I want to believe she has a flyer, but that's just the overview of what the workshop is going to be about. Thank you so much, everybody. I hope it was good value for your time. I hope it was good value for your time. I think we have actually asked questions in between anyways. So Lavender Care, over to you.
Wow, what an amazing session. You called me a doctor like how many times? Maybe that's a sign.
Right.
Can I go back to medical school like this? Is it too late to go back to school?
You can know. You can know. Thank you so much.
Okay, thank you so much for your time. It's been such an amazing session. I've learned a lot, and I know that everyone on this call has also learned so much. The questions, I mean, I think, like you said, we had questions during the course of your presentation, so I think that just solves it, answers the or covers for the question and answer session.
Right.
So to everyone who has joined, I want to say thank you. And just like she said, um, we thought that it wasn't enough to just host this webinar, so you give you like um, a surface level or have a surface level conversation about these issues. But we've decided to take it a step further. What we've decided to do is to host a 10-day workshop. As a matter of fact, it was supposed to be, we had to, like she said, I twisted our arm a lot to just ensure that we had a good affordable rate that everyone who needs this help can actually afford to pay for it. She's not affordable, though. But I really appreciate that she was able to give us a good rate to be able to get moms to pay for this service. So, like she said, it's going to be a 10-day workshop. It's going to be practical. So you are not just told what to do or maybe what you read online, or I mean, like she had shared a lot of information on this call, but it's going to be basically holding your hands and walking you through the process of healing. So I have the flyer here. I'll just share. I'm hoping that everyone here registered. If you did not register, I'll just quickly drop the form here, just so that I can have your email and phone number and then send you details afterwards. Let me just do that right away. It's the same form for the webinar registration, but I mean, we need, like again, like I said, we need your email and your phone number so that we can talk to you about this workshop. So yes, before we go, I don't know if anyone has any questions. I believe everyone asked their questions during the course of the webinar. But if you still do, you can, while you're filling the form, you can just ask a question. There's a spot for you to be able to do that. Before we go, I'd just like to say again that the postpartum period is super important. Whether you are pregnant or you know a pregnant or postpartum mom, let's continue the conversation outside of here. You are important as a mom, and it's important for you to care for yourself so that you can care for your baby and your family. One of the things that we also do as a brand is we want you to have a robust, like an all-round wellness. And one of the things that we do is we have a tool. It's a screening tool for moms. Helps you to screen for mental health in 4 simple steps. Um, I'll quickly once again share the link here. Very easy to use. It's a screening tool, and we've partnered with some healthcare professionals, therapists, to be able to provide you as a mom with support if you need. you need it. So once again, I'll just share the link here so that you can look at it and see if it's something that will be beneficial to you. As a matter of fact, I think it's important as moms to always check in on ourselves. No one, you people would care for you um, as long as you're ready to care for yourself. So it's important to make it a point of duty to yourself to say, you know what, I'm going to prioritize myself. I'm going to prioritize my mental health. If you click that link, I can just quickly share my screen and show you what you would see once you click on the link I just um, shared now in the chat. I hope that everyone can see that. 1 minute, please. Don't worry, this will be quick. I know that we've taken a lot of the time, but please bear with us. Um, okay, I'm doing that right away. Uh, okay, I have a lot of things open here.
Mhm.
Yeah, um, I'm trying to find it. Okay, let me just come here. Okay, so like I said, in four simple steps, basically three simple steps, you can check in on your mental health, whether you're a pregnant mom or a postpartum mom, um, or you are not even pregnant, you're a woman, you can check in on your mental health. It helps you just get the help that you need when you truly need it. So thank you so much, everyone. Um, yes, let me just see if I could share something with you. I mean, there are so many links. I hope that if you registered, then you'll get an email following this call with all the details that you need to register for the webinar, for the workshop rather, and then every other detail. Like she said, she's going to do a free pelvic floor assessment for everyone who registers early. And I think that's an amazing one because it would normally have come at a cost, but she'll be doing that for free. So distance is not a barrier. You can access this support virtually, and then you can get the support and the care that you need to thrive as a woman, as a mother, and as a wife, really. So once again, I want to say thank you so much for joining in today. It was such an honor to have hosted you this evening. Thank you and have a good evening.